Hannah, you've had a difficult problem with your knee, and you've had a total of 4 surgeries, and you've got a smile on today because you're going to start back
Yep.
doing what? Which,
Playing softball.
yeah, and you can brag a little bit. You're a pitcher, and you do fast pitch, right?
Yep.
And that's really an aggressive pitching motion, isn't it? And how old are you now?
15.
15. And 4 years ago is when it started, when you were about 11, and you suddenly started having pain in your knee, and it got so bad that you were having trouble with just walking activities.
Yeah, anything, stairs, walking.
Right.
Anything bending.
And you had a diagnosis that was a long one, and it's called osteochondritis dissecans, and you know what that means. It really means part of your cartilage just separates from your joint. And so you're left with a big divot in your joint. And you had the first procedure which was done, which was to pin that separated fragment back into your knee joint. And that didn't work, did it? And sometimes you probably were told it's difficult to get that to heal. And so you went on, and we kind of took over your care after those first 2 surgeries. And we tried to do the same thing, which was to pin back your original lining. And was that very difficult for you? That's not an easy operation.
Yeah.
And you had to be on crutches for a while.
12, 13 weeks.
Yeah. And the goal of that was to try to save your remaining lining, which was an important goal. And the reason we're kind of interviewing you is you had to go to the second step because your original lining was all fragmented by that time. And even though we tried to save it, it just fragmented. Part of it healed, if you remember. So we had to go back in. And can you tell us what we did? Do you have a pretty good understanding of what we did the second time?
They took 1 screw out and then put 3 bone plugs in the lesion.
That's right. And so we took some cartilage and bone plugs from a low pressure area of your knee joint, kind of rob Peter to pay Paul, so to speak, and we transferred that into the defect. And that was a pretty big area that we transferred it into. And we're happy to report that that's worked, hasn't it? And it's now a year after that procedure, and we've had an MRI, and that shows that that lining has been restored. So that's called an osteochondral transfer. And then there's a third part that we don't think you're going to need, and that's where we put a patch in, where we take some of your own lining and put a patch in there. And we think you're good enough with the cartilage that you have, and the lining that you have. And are you having symptoms now?
No.
Okay, so we can say that really enthusiastically. You're doing very well now, aren't you? Yeah, and in fact, we've honestly told you that we don't know how long that'll hold up, but it looks very, very good on the MRI. And so you're going to go back to the pitching, and we think you're going to do very well on the pitching. And I think it's kind of important from a surgeon's perspective that in the old days we used to not have any treatment at all. And usually that fragment was just removed. And over about 7 to 8 years, the studies show that the joint would just deteriorate. And you certainly don't want to be in that area because you're just much, much too young to consider that. And so these cartilage procedures to restore lining were developed now quite a few years ago, but it does represent a real advance, I think, in treating the knee joint. So we're glad that you have a good result, and we wish you the very best. And you're still going to take it easy on it a little bit, though, aren't you? Yeah. And we've kind of thought that maybe you shouldn't do impact loading like basketball. Maybe we should pick, at this point, be very glad that we can resume a sport, and it would be better as we get back to pick one sport. And you didn't like that when I suggested maybe that wouldn't be so good, right?
Yeah.
Yeah, I know you didn't like that. But do you feel comfortable with that we can get you back to the one sport? Let's try that out.
I'm happy with that.
Yeah, I'm happy with that too. Good luck to you.
Thank you.
Okay, thank you very much.